A new study finds the number of Americans seeking cosmetic surgery is growing as the economy rebounds. In particular, more women are investing in their appearance these days, as CBS News correspondent Michelle Miller reports.
It could be a sure sign the recession is over. Many who spent the last 2 years pinching pennies at the pump, clipping coupons, and even eating out less are now spending more in an unexpected way on pampering and plastic surgery. Until recently, fixing her nose seemed financially risky for 38-year-old Shadia Crandall.
You know, the economy was really dicey, and with 2 kids, a mortgage, tuition, food, I had priorities, and it was scary.
As the economy hit the skids in 2008, cosmetic procedures took a nosedive.
When the economy first took a downward turn, this plastic surgery industry as a whole basically shut down. I mean, people were down 50%. And we're just struggling to get by.
But with the economy continuing to rebound, people across the country are again splurging on beauty, from wrinkle-reducing injections to plastic surgery.
It was really hard putting off my surgery. I've wanted to do it for a really long time.
We want to reduce that bump.
35-year-old jewelry designer Cassie Porter saved and struggled through the recession. Now she can finally afford to get the nose she wished she'd been born with. And she's not alone. According to the American Society of Plastic Surgeons, 13.1 million cosmetic procedures were performed last year. That's a 5% increase from 2009. More than 5 million people opted for Botox injections in 2010. And another 2 million requested facial fillers.
Brows, the eyelids,
51-year-old Vicky Binko waited until her company layoffs were behind her before going ahead with a brow lift and tightening her upper and lower eyelids.
I waited to have plastic surgery for about 3 years due to the economy. That was a scary time.
To some, cosmetic surgery may be a luxury item. Not so for these women who, in the end, aren't willing to put a price on looking their best.
I look more rested, I look more energetic. It was a good investment.
I see a confident woman who smiles every time I have an opportunity, so I absolutely love it.
Michelle Miller, CBS News.
And joining us here in the studio this morning is plastic surgeon Dr. Jan Trokel. Good to have you back with us this morning.
Good morning, Erica.
Talk to us a little bit. Have you noticed a change in people coming into your office and the procedures they're requesting?
You know, with the economy now rebounding, we're actually seeing more people scheduling for consultations. But more importantly, not only are they scheduling, they're going ahead with the procedures.
And what are some of the most requested procedures at this point?
People are coming in now, they're asking for liposuction, they're asking for facelifts, they're asking for full makeovers. I would see patients like 9 months ago, and they would just come in for the consultation. But now they're coming back in, and they're actually going ahead with the procedures.
And they're going further than just coming in and saying, well, maybe I'll get a little Botox, an injection of this. They actually want to go under the knife.
They actually do.
And do they tell you that they want to do this because they're feeling more financially secure?
Yes. 9 months ago when they would come in, they would say, doctor, is there anything I can do just to get by? Give me that little Band-Aid. So a little Botox, a little filler, and it went a long way. Today, they're coming in and saying, I'm ready for the full surgery. I want to look great. I feel great. I'm back in the game. I feel better economically, financially, and please, what can I do to make me look better?
So for someone at home who may be feeling that way, whether it is something as seemingly simple as an injection or something much bigger like a full body makeover, what are some of the important questions to ask when you go in and meet with a surgeon?
You know, credentials are very important, but that's not the only thing. Look at the doctor. Plastic surgery is an art. You need somebody that has good eyes and good hands, a good artistry. Make sure they have the same vision as you and that they can actually perform the procedure you want. Look at the before and after pictures. Speak to the people that they've worked on. Look at their work. That tells you more than anything else.
And of course, if anyone doesn't want to show you their work, that should be a red flag, I would imagine.
A big red flag, and especially if they only have one case to show. Let them show you a lot.
Right.
If they don't want to show you the work and they say, oh, just believe me, head for the door.
Exactly. Get out of there as quickly as you can. Is this something that you can, try to negotiate a deal on? I mean, we've talked about in the past on this show being able to negotiate a price on your knee surgery. Can you do that with, say, a facelift?
You know, everything has a price. You can actually, when you go and do multiple procedures, you're actually saving money. Think about it. You pay the surgeon's fee, But when you're doing, let's say, your face and your nose and maybe a little body work, you're only paying one anesthesia fee and one surgical center fee. So there you go, you come out ahead.
Okay, so if you can try to group it together, it's a good way to negotiate.
It's a good way to negotiate.
Dr. Yantrokel, good to have you back with us. Thanks so much.